Administration instructions for DuoDote Auto-Injector. Atropine and pralidoxime chloride injection. DuoDote, a combination of atropine, a cholinergic muscarinic antagonist, and pralidoxime chloride, a cholinesterase reactivator, is indicated for the treatment of poisoning by organophosphorus nerve agents, as well as organophosphorus insecticides in adults and pediatric patients weighing more than 41 kilograms, 90 pounds. To learn more about DuoDote and other Meridian products, please visit meridianmeds.com. The health information contained herein is provided for educational purposes only. All decisions regarding patient care must be made considering the unique characteristics of the patient. Important safety information is available at the end of this video. You can view full prescribing information at meridianmeds.com. This video is intended for emergency medical personnel and first responders. In it, we'll explain the symptoms of organophosphorus chemical nerve agent and insecticide poisoning, dosing information, how to administer the DuoDote auto-injector, and selected safety information. Please note, the auto-injector administration portion of this video is not scenario-based. Rather, it is a simulation performed in a controlled environment. Let's begin with symptoms. First, you'll need to assess the victim for potential poisoning. The victim may begin to experience symptoms of poisoning within minutes of exposure, and mild symptoms will occur before severe symptoms. Mild symptoms can include blurred vision, unexplained teary eyes and runny nose, difficulty breathing, nausea and/or vomiting, and stomach cramps. Keep in mind that the victim may not have all symptoms. Severe symptoms may appear within 1 to 10 minutes after significant inhalation exposure, and death can occur within anywhere from 1 minute to 18 hours, depending on the specific poison. It is important to remember that the DuoDote auto-injector is intended as an initial treatment of the symptoms of organophosphorus insecticide or nerve agent poisoning. Definitive medical care should be sought immediately. The mnemonic sludgem may be a useful tool to help you remember the signs and symptoms: salivation, lacrimation, urination, defecation, gastroenteritis, emesis, and meiosis. Now that we've described what to look for, we're going to explain how to treat organophosphorus nerve agent or insecticide poisoning with DuoDote. It is important that treatment decisions be made using appropriate medical judgment by emergency medical personnel. A little later, we'll demonstrate how to inject DuoDote. 3 DuoDote auto-injectors should be available for use in each patient, including healthcare providers, at risk for organophosphorus poisoning. 1 for mild symptoms plus 2 more for severe symptoms. Only administer DuoDote to patients experiencing symptoms of organophosphorus poisoning in a situation where exposure is known or suspected. If the patient experiences 2 or more of the following mild symptoms of nerve agent or insecticide exposure, administer 1 DuoDote injection intramuscularly into the mid-lateral thigh. Wait 10 to 15 minutes for DuoDote to take effect. If, after 10 to 15 minutes, the patient does not develop any of the severe symptoms, no additional DuoDote injections are recommended. If at any time after the first dose the patient has any of the severe symptoms, administer 2 additional DuoDote injections intramuscularly in rapid succession. If a patient initially presents with any of the severe symptoms, immediately administer 3 DuoDote injections intramuscularly into the patient's mid-lateral thigh in rapid succession. Emergency care of the severely poisoned individual should include removal of oral and bronchial secretions, maintenance of a patent airway, supplemental oxygen, and, if necessary, artificial ventilation. An anticonvulsant such as benzodiazepine may be administered to treat convulsions if suspected in the unconscious individual. The effects of nerve agents and some insecticides can mask the motor signs of a seizure. Close supervision of all severely poisoned patients is indicated for at least 48 to 72 hours. Warnings and precautions include cardiovascular (CV) risks, tachycardia, palpitations, premature ventricular contractions, flutter, fibrillation, etc. Use caution in patients with known CV disease or conduction problems. Heat injury may inhibit sweating and lead to hyperthermia. Avoid excessive exercising in heat exposure. Acute glaucoma may precipitate in susceptible individuals. Urinary retention. Administer with caution in patient with bladder outflow obstruction. Pyloric stenosis may convert into complete obstruction. Exacerbation of chronic lung disease. Atropine may cause inspiration of bronchial secretions and formation of dangerous viscid plugs in individuals with chronic lung disease. Monitor respiratory status. We've described the symptoms of organophosphorus chemical nerve agent or insecticide poisoning and dosing information for DuoDote. Now we're going to demonstrate how to administer the auto-injector itself. Using Meridian's proprietary Bineject technology, the DuoDote auto-injector delivers two drugs, atropine and pralidoxine chloride, sequentially through a single needle, resulting in a single injection. Next, we're going to perform a simulation of DuoDote administration. Please note this is a controlled setting and the necessary protective equipment to prevent chemical nerve agent exposure is not being worn. The following steps are intended to help you be prepared in the event of an emergency involving an organophosphorus chemical nerve agent or insecticide. Keep in mind that the auto-injector can be administered through clothing and protective garments. Tear open the plastic pouch at any of the notches. You can now remove the DuoDote auto-injector from the pouch. Place the DuoDote auto-injector in your dominant hand. If you are right-handed, your right hand is dominant. Firmly grasp the center of the DuoDote auto-injector with the green tip, which is the needle end pointing down. Because it could result in accidental injection, be sure to never touch the green tip. With your other hand, pull off the gray safety release. The DuoDote auto-injector is now ready to be administered. The injection site is the mid-lateral thigh area. The DuoDote auto-injector can inject through clothing. However, make sure pockets at the injection site are empty. Firmly push the green tip straight down at a 90-degree angle against the mid-lateral thigh. Continue to firmly push until you feel the DuoDote auto-injector trigger. It is important that after the auto-injector triggers, you hold the DuoDote auto-injector firmly in place against the injection site for approximately 10 seconds. The DuoDote auto-injector may also be administered to a colleague or patient by performing all of the previous steps and administering the injector in the victim's mid-lateral thigh. Make sure that the person's pockets are empty at the injection site. People who may not have a lot of fat at the injection site should also be injected in the mid-lateral thigh. But before giving the injection, bunch up the thigh to provide a thicker area for injection. Continue to hold in place for 10 seconds. After injecting, remove the DuoDote auto-injector from the thigh and look at the green tip. If the needle is visible, the drug has been administered. If the needle is not visible, check to be sure the gray safety release has been removed and then repeat steps 4 and 5, but push harder in step 5. After the drug has been administered, push the needle against a hard surface to bend the needle back against the DuoDote auto-injector. Put the used DuoDote auto-injector back into the plastic pouch if available. Leave used DuoDote auto-injectors with the patient to allow other medical personnel to see the number of DuoDote auto-injectors administered. You can also refer to your local protocol for direction on how to track emergency medication use. Immediately move yourself and the patient away from the contaminated area and seek definitive medical care for the patient. It is also important to take the appropriate decontamination measures. Now that we've covered the symptoms of organophosphorus poisoning and dosing and administration for DuoDote, we'll go over selected safety information. There are no contraindications to the use of DuoDote. In cases where DuoDote is inadvertently administered to people who are not poisoned with nerve agent or organophosphorus insecticide, patients should avoid potentially dangerous overheating, avoid vigorous physical activity, and seek medical attention as soon as feasible. To help you identify symptoms of overdose, you can refer to the DuoDote prescribing information. For atropine overdose, supportive treatment should be administered. If respiration is depressed, artificial respiration with oxygen is necessary. A benzodiazepine may be needed to control marked excitement and convulsions. Pralidoxime-induced hypertension has been treated by administering phentolamine 5 milligrams intravenously, repeated if necessary due to phentalamine's short duration of action. Common adverse reactions of atropine include dryness of mouth, blurred vision, dry eyes, photophobia, confusion, headache, and dizziness, among others. Muscle tightness and sometimes pain may occur at the injection site. The common adverse reactions of pralidoxime chloride include changes in vision, increased blood pressure, hyperventilation, dizziness, muscular weakness, decreased renal function, headache, dry mouth, excitement, drowsiness, emesis, manic behavior, nausea, rash, transient elevation of liver enzymes, and creatine phosphokinase, tachycardia, and dry skin. Safety and effectiveness of DuoDote in pediatric patients weighing less than or equal to 41 kilograms, 90 pounds, have not been established. DuoDote should be stored at 25 degrees Celsius or 77 degrees Fahrenheit. Excursions are permitted between 15 degrees and 30 degrees Celsius, or 59 degrees and 86 degrees Fahrenheit. But DuoDote auto-injector should be kept from freezing. Each DuoDote auto-injector is also supplied in a pouch that provides protection from light. We hope that you found this video useful and that you feel better able to recognize and treat victims of organophosphorus nerve agent or insecticide poisoning. The DuoDote auto-injector is only available with a prescription and is intended for use by emergency medical personnel who have had adequate training in the recognition and treatment of nerve agent or insecticide poisoning. Please keep watching for important safety information on DuoDote. Important safety information. There are no contraindications to the use of DuoDote. Cardiovascular risks include tachycardia, palpitations, premature ventricular contractions, flutter, fibrillation, asystole, and myocardial infarction. Other cardiovascular adverse reactions have also been reported. Use caution in patients with known CV disease or conduction problems. Heat injury may occur. Atropine may inhibit sweating and lead to hypothermia. Avoid excessive exercising and heat exposure. Acute glaucoma may be precipitated in susceptible individuals, and therefore DuoDote should be administered with caution in patients at risk for acute glaucoma. Administer with caution in patients with bladder outflow obstruction, as urinary retention may occur. DuoDote should be administered with caution in patients with partial pyloric stenosis because of the risk of complete pyloric obstruction. Atropine may cause inspiration of bronchial secretions and formation of dangerous viscid plugs and may exacerbate chronic lung disease. Monitor respiratory status. Common adverse reactions of atropine include dryness of the mouth, blurred vision, dry eyes, photophobia, confusion, headache, and dizziness, among others. The common adverse reactions of pralidoxime chloride include changes in vision, dizziness, headache, drowsiness, nausea, tachycardia, increased blood pressure, muscular weakness, dry mouth, emesis, rash, dry skin, hyperventilation, decreased renal function, excitement, manic behavior, and transient elevation of liver enzymes and creatine phosphokinase. Muscle tightness and pain may occur at the injection site. Patients who have received succinylcholine and mivacurium may exhibit an accelerated reversal of the neuromuscular blocking effects when treated with DuoDote. Monitor neuromuscular effects with concomitant administration. Safety and effectiveness of DuoDote in pediatric patients weighing less than or equal to 41 kilograms, 90 pounds, have not been established. Geriatric patients may be more susceptible to the effects of atropine. Pralidoxime chloride can cause decreased renal function. Patients with severe renal impairment may require less frequent doses after the initial dose. Patients with severe hepatic impairment may require less frequent doses after the initial dose. View the full prescribing information for DuoDote at meridianmeds.com. This video is intended to be viewed within the context of its original location online. Pfizer is not responsible for the content if viewed elsewhere. The product information provided in this video is intended only for healthcare professionals in the United States. The products discussed herein may have different product labeling in different countries. If you wish to report an adverse event or product quality complaint, please call 1-800-438-1985. For medical questions concerning Meridian products, to report an adverse event, or to speak to a member of Pfizer U.S. Medical Information, please call 1-800-438-1985. You are encouraged to report side effects of prescription drugs to the FDA. Visit fda.gov/medwatch or call 1-800-FDA-1088. If you have a medical question concerning Meridian products, please call 1-800-438-1985. U.S. HCPs can visit PfizerMedInfo.com. For information about ordering DuoDote or for additional training materials, please call a Meridian representative at 1-800-638-8093 or visit meridianmeds.com.